Personal and public health will be impaired without healthy environment. And a healthy environment relies on proper sanitation. This brings us to our focus today, environmental sanitation, which encompasses the collection and safe disposal of all types of waste to protect and enhance community health and quality of life. Welcome to Hude Hour, the flagship program of Hude Network, where we discuss key developments in the humanitarian and development space. I am your host, Amadine Ogbewe.
And I am Joan Eze. Remember, your environment extends to your neighbor's space, making achieving a healthy environment a shared responsibility.
Absolutely. Today on Hude Hour, we will explore the challenges and strategies related to environmental sanitation worldwide, along with the latest news on the current state of affairs. Let's take a look now at the headlines. India records reduction in infant mortality via sanitation efforts. Oman launches environmental sanitation initiative. African Water Facility secures €12 million funding. Uzbekistan establishes inter-institutional working group. Now let's go on a break. When we return, we'll delve more into environmental sanitation. According to United Nations Children's Fund, that's UNICEF, billions of people lack access to safe drinking water, sanitation, and hygiene. This is commonly known as WASH. And this poses severe risk, especially to children. Each day, hundreds of children under 5 die from preventable diarrheal diseases linked to inadequate WASH services. Many miss out on vital nutrients and education due to illness from unsafe water. Urban and rural children, particularly those in climate-affected areas, are often most disadvantaged. During humanitarian crises, the risk increases, with children in conflict zones nearly 20 times more likely to die from diarrheal diseases than from violence. While billions have gained access to basic drinking water and sanitation since 2000, many of these services remain unsafe. Numerous homes, healthcare facilities, and schools still lack soap and water for hand washing, raising health risk, especially for young children who are more susceptible to diseases like diarrhea. According to World Health Organization, 73% of the world's population used safely managed drinking water services in 2022. 3.5 billion people lacked safely managed sanitation services in the same year, and 2.0 billion people lacked hand-washing facilities with soap and water at home, again in 2022.
The WHO says that in 2016, 13.7 million deaths occurred due to modifiable environmental risk, accounting for 24% of global death. Nearly 1 in 4 deaths worldwide are linked to environmental conditions. Unhealthy environmental conditions impact a wide range of diseases and injuries, with non-communicable diseases like ischemia heart disease, chronic respiratory diseases, and cancers being the most frequent outcomes. Additionally, injuries, respiratory infections, and strokes are also significantly affected.
Indeed, environmental sanitation plays a vital role in achieving the Sustainable Development Goals by addressing critical issues related to health, water, and sustainability. Effective sanitation and waste management not only enhance public health, but also contribute to environmental protection in communities. The following SDGs are particularly relevant to the promotion of environmental sanitation. We have the SDG 3, on good health and well-being, SDG 6 on clean water and sanitation, SDG 11, sustainable cities and communities, SDG 12, responsible consumption and production, and SDG 13, climate action. Now we'll go on a break, and when we return, we'll take a look at some examples from across the globe on environmental sanitation's progress so far. Stay with us. Welcome back. This is still Hude Hour on Hude Network. And let's go straight into our news items. India's Swachh Bharat mission, SBM, has made significant strides in improving public health by reducing infant and under 5 mortality rates, saving approximately 60,000 to 70,000 lives each year. A recent study published in Nature underscores the mission's success, revealing that villages with full toilet access show less contamination in soil and groundwater compared to those without complete sanitation coverage. Launched on October 2, 2014 by Prime Minister Narendra Modi, the SBM aims to eliminate open defecation by promoting the construction of household toilets. To date, the mission has successfully built over 117 million toilets, benefiting more than 500 million people across 630,000 villages. The findings of the study emphasize the critical role of sanitation in improving child health and reducing mortality rates. It advocates, for the continuation of sanitation programs as essential components of public health strategies. The research highlights the need to sustain behavioral changes and ensure that toilets are used effectively to maximize health benefits. As India celebrated Cleanliness in Service 2024 from September 17 to October 2, the SBM continued to advance Sustainable Development Goal 6, which focuses on providing equitable sanitation access, particularly for women and girls. The mission is viewed as a crucial initiative in promoting overall health and environmental safety across the country. Well, that's India there for you, doing their best to, fix the issues around sanitation.
Yeah.
And I'm really curious about how they are building household toilets for people. And I just try to put myself in the shoes. I know we're talking about regions that might not be so developed, but it's interesting having this situation where you're in your home and for some reason or another, you have not made some, will I say, opportunities to have indoor sanitation or within your home household toilets. And then to see the government and the SBM show up and say, you know what, don't worry about that. We're here to handle that for you. I think it would really put a smile on the face of Indians out there. We've seen the numbers over hundreds, 170 million household toilets.
Yeah.
And we have
500,000.
yes, a million people
have
being
benefited.
benefited by this. So I think it's a good one for those persons from their point of view, knowing that my government has got my back as regards this. And if it's so important for them that they have to come into my home to build my own toilets, it must be an important issue that I should also take seriously.
Yes, obviously, the rate of open defecation and the spoiling of groundwater and soil has actually triggered this action of the SBM and India, of course, because imagine you don't have access to good toilets.
Yeah.
The only place you can run to is the ground
Right outside,
outside,
yeah.
of course. So I feel this action that they've taken to build toilets, provide accessible toilet for households, for people in their various homes, is a very good way to start with the environmental sanitation.
Indeed.
All right, let's move over to the next news item we have. Here, the Environment Department of South Al Shakia Governorate in Oman has launched the Environmental Sanitation Initiative to enhance cleanliness in various locations. This extensive campaign focuses on cleaning valleys and residential areas, involving multiple government agencies, private organizations, and volunteers of all ages. And of course, here we have Engineer Saeed bin Nasir Al Abdali, Director of the Environment Department, highlighted that the initiative supports the governorate's vision for a healthier environment aligned with sustainable development goals. He emphasized the dual benefits of improving neighborhood aesthetics and reducing pollution's harmful effects on wildlife and water resources. Addressing the critical issue of plastic waste, which he called a silent disaster, Al Abdali stressed the need for alternatives to plastic and fostering a recycling friendly ecosystem. Okay, so it's very important to note that Oman has built or carried out an initiative to go to residents, to curb out environmental disaster. And it has two reasons. This is to build aesthetics in people's homes. Aesthetics, that's to make sure that there's creativity, your home is looking very hospitable and very nice. And of course, to end pollution and water disaster. And of course, this aspect of tackling recycling is a very, very good one. He calls it a silent disaster. Yes, it's a silent one because people don't, you imagine you finish taking a bottled water or a bottled drink and you just trash it anywhere you feel like. It constitutes environmental nuisance. So for Al Abdali to take up this initiative to say, okay, this silent disaster, it's time for it to go in order to bring back a good environment, sanitation, and all
Indeed.
of that.
And I think one of the messages perhaps we'll continue to push as the program goes along is how environmental sanitation is a public health issue. Because I think we all know that clean environment is much better. I particularly love the multi-sectoral approach, and like
The
we always
involvement of private organizations,
yes, indeed.
individuals,
It's basically
volunteers.
calling everyone to come in. And there's also this
course.
aspect of sensitization, trying to get the people to know the things that they should. So it's a good one from Oman. And I think that, again, the fact that such an initiative has been launched shows the importance that a government places on it. And perhaps in the long run, it will scale to the people that, millions of dollars or whatever currency that each country might be using being poured into these means that it should be taken seriously. Anyway, that's how we end this segment of the program. We'll go on a break, and when we return, we'll bring you two more news items just to round up what is happening on the global perspective as regards environmental sanitation. After that, we'll be joined by our guest to do justice to the matter. Stay with us. We'll be right back. Welcome back. And now to our next news item. The African Water Facility has announced a new funding initiative, the African Urban Sanitation Investment Initiative, also known as OSSI, and secured it with 12 million euros from the Nordic Development Fund, launched on August 27, 2024, during World Water Week. OSSI claims to enhance access to safe and sustainable sanitation across African cities. Over the next decade, the initiative plans to mobilize $320 million to support 50 sanitation projects, providing safely managed sanitation services to at least 15 million people in urban areas and generating $7 billion in downstream investments. 10% of this funding is expected to come from climate-focused sources. The coordinator of the African Water Facility expressed hope for further partnerships to support this initiative, which aims to ensure inclusive access to sanitation and spur development across the continent. The managing director of the Nordic Development Fund emphasized the urgent need for innovative solutions to address Africa's sanitation crisis, particularly as urban population grow and climate challenges escalate. I think the theme of our news item so far is preparation for sanitation and preparation so that things don't get worse and things get better. Where OSCE is trying to target climate change affecting or exacerbating some of these issues. And on the flip side, trying to ensure inclusivity in environmental sanitation efforts, because when it all comes to the development of humanitarian space, the attempt is always to try and put it to the lowest rung of the society, people who are often marginalized and forgotten. So this, I think, this is the part where people might call the boring aspect of things. But the truth is that you can't do anything without funding.
Yeah.
And it's good to see that this funding is being proposed for innovative ideas of environmental sanitation. And that's what I'm concerned about. I hope to see what that looks like. What does it look like to be innovative about environmental sanitation? Well, we'll find out, like Ossie is doing.
Yeah, Aussie is really, really going to do something very good because I've actually researched about Aussie and I've seen that they really, really carry out very good um, exercise in making sure that environmental sanitation is very, very good. And for the aspect of funding, they actually help to give out money to countries, right, to help in the environmental sanitation exercise. So, well, kudos to them. And I look for, just like what you said, I look forward to seeing how their environment will transform with the presence of Aussie. Okay, so let's move to the next new item we have. Um, Uzbekistan, the most populous country in Central Asia with approximately 35 million residents, is addressing critical water stress and inefficient water usage amidst its growing mining industry, a major producer of gold and uranium. As the mining sector expands, concerns over environmental and health risk, particularly water pollution from tailings management, have intensified. In response, Uzbekistan launched the Interinstitutional Working Group, IIWG, aimed at preventing water pollution and ensuring tailings safety. The group convened for its first time meeting today as part of a project to enhance water and sanitation management in the face of climate change, funded by the Swiss Agency for Development and Cooperation and implemented under the UNECE WHO Europe Protocol on Water and Health. Okay, so Mr. Iskander, Deputy Minister of Ecology, emphasized the importance of water quality and health, urging IIWG members to collaborate and share knowledge. The working group formed in July 2024 includes representatives from various ministries focused on water resources, sanitation, industrial safety, and disaster risk reduction. Okay, that's a very good one from Uzbekistan. And, they are actually one of the largest, most populous Central Asia country with a population of 35 million people. And they've made sure that with the presence of their mining aspect of their economy, they want to address the environmental crisis that they are experiencing due to the economic, will I say, gifts, right? And they've set up an interinstitutional group to carry out this particular exercise to make sure that the environment is on point.
Yeah, it's a good one. Like you said, sometimes countries are blessed with some natural resources that can tend to turn into a curse, and it's good to see Uzbekistan,
Tackling
trying
the
to
issue,
get ahead of it and say, okay, well, we have the blessings, we are going to work so that it don't turn into something else. And it's a good one, and I like again the interinstitutional aspect of it and the way there's always a need for collaboration, and we just want to see what that keeps looking like, and what efforts, or pardon me, what results these efforts tend to end up in at the end of the day. So we'll pay attention to Uzbekistan more and see how far they go with that alongside other nations. Well, that's all we'll take on this segment of the program. We'll take a short break. When we return, we'll be joined by a guest to do justice to the matter, speaking on the person of Mr. Kene Ojo. He's an environmental health expert and officer, and he will be here to speak on environmental sanitation and the way forward. Stay with us. We'll be right back. Every day, amazing stories of hope and tenacity unfold across the globe. On Hude Hour, we dive into these inspiring tales and discuss the vital work being done in the humanitarian and development space. Humanity has never faced a shortage of challenges, yet we rise stronger through teamwork and determination. Though these remedies are often underreported, on Hude Hour, we advocate sustainable solutions. We bring you the latest and most impactful news on how lives are being changed. We engage with young change makers and experts who provide valuable insights into relief efforts and the challenges faced by local communities through a global perspective. Join us every Wednesday by 8 a.m. on Hude Network's YouTube channel as we embark on this journey of positive change. Welcome back. If you're just joining us, this is still Hude Hour on Hude Network. We've been joined now in the studio by a very special guest, an expert in the field, Mr. Sanitarian Tijani Egene Enojo. He is an environmental health specialist and also with the council in Nigeria. He's here to do justice to the issue at hand, which is environmental sanitation. Welcome to the program.
Thank you for having me. Thank you.
All right, we'll start with the basics just to get into it. As we currently speak, there's still a lack of access to sanitation, facilities and clean water. So let's start with that basic aspect of it. When we talk about water generally, people see that something that is everywhere and is very regular and free. How much importance is it simply having clean water to the aspect of environmental sanitation?
Yeah, when you go into the details of water, water is generally and universally acceptable to all. But anything that alter the quality of water, make it unwholesome for human consumption. Then water is everywhere, but the purity of water cannot be ascertained. And that is as a result of our attitude, individual contribution, from small to the end. Everybody contributes to the lack of quality water in our society. So when you take your attitude, how do you dispose your waste? Let's start from waste. How do you manage your waste? In a family, when a child is going to toilets, they make use of, is it diapers or pampers? After the child defecates, how do you manage that waste? It becomes an issue. So many people channel their soak away into the body of water. That is an issue. So many people channel their pipe from the toilet into the gutter on the road, right? And when rain falls, it washes away all this thing into the body of water. During the dry season, you see people going to toilet here and there in an open space. When rain falls, what happens? It washes away this surface soil into the body of water. And there are communities down the drains that need that water for their drinking, for their cooking, for their washing, and other agricultural activities. And when water is unsafe, it brings about different kinds of disease, like cholera, like dysentery, like typhoid, gastroenteritis generally, and other diseases that arise as a result of poor water supply or poor sanitation generally.
So long and short of it, water is very important.
Water is life. Yes, water is life. If you drink a healthy water, you see how you look okay. That is why the World Health recommends you to drink enough water, even before bed and after bed. That is why when you wake up in the morning, the first thing you need to do before you brush is to take at least a glass of water. And that water, if it's clean, you will be healthy. But if it's not clean, it poses you to different other health associated diseases, as earlier mentioned.
All right, John, just before you come in, let's take just some look at some statistics and just to get your response. On sanitation, this is coming from the WHO, like we said earlier, 3.5 billion people lacked safely managed sanitation services in 2022. On hygiene, 2 billion people lacked hand washing facilities with soap and water at home in 2022. But let's stick to the sanitation aspect now. 3.5 billion people lacked safely managed sanitation services in 2022. This is a big issue considering the total number of the world's population.
Yeah.
So the question is, who would you attribute this to? Let's assume we wanted to make it sort of where we're apportioning blame so we can solve the issue. Who are the stakeholders involved to ensure this number drops drastically? Or why it even got to this place in the first place?
Now, when you talk of sanitation, that number is huge, right? And if you talk about sanitation, it is everybody's responsibility to reduce it, starting from the household. Yes, starting from the household. And if you look at it critically, you see that one of the factors that contribute to this poor sanitation is overpopulation and lack of access to toilet facilities, lack of access to water facilities, poor housing. If you go to some places, you see they are still living in a slum. And those kind of people, they do not have enough resources to feed themselves. Then how do you expect them to build toilet facility for themselves? And so many people, out of ignorance, prefer to go into the bush to defecate. If we provide toilet facilities, they will not make use of it. And some traditionally, right, or religiously, prefer that, okay, a male and female are supposed not to go into the same toilet facilities. That is for their own spiritual belief. So if you look at this thing, these are factors. The first thing to do is to change the orientation of the population. Educate them, enlighten them, just like what we are doing now. It is my responsibility to enlighten the community, to enlighten the rural people, to enlighten the urban setting on what is ought to be done. And once that is done, who monitor them? We also go back there to educate them, to monitor them that what we came to tell them in the first place has been corrected. And if it's not corrected, there are backup legal procedures that we will have to take it to force them to do it, or we do it by ourselves and force you to pay for the service rendered.
Oh, okay. You said something about you telling people, you see people doing it back again, like the whole back and forth. You tell people not to do this and they prefer the open defecation and all that. For 13 years and above, you've been an environmental officer and you've gone for inspection. You've tried to implement what your job description is all about. How has it been? How has the journey been so far for you? And how have you really implemented environmental sanitation in the mind of the people?
Yes, just like you rightly said, it is very difficult to control human than animal, right? And what we do is to continue talking. Yes, we continue doing the talking. And then one thing that is very, very critical for us to achieve this is thorough enforcement. People need to be forced to do the right thing. Otherwise, what you need to do to protect yourself, to protect your children, to protect the society, you are claiming right on it. From my experience so far, people are difficult to change. Yes, people are difficult to change because when you go to a premises and say, oh, you don't have a toilet or you have a toilet facility but it's poorly managed, they will agree with you to do it. But once you go and come back for a revisit, the same problem remains. And if you take that person to court for a court process, they say you are wicked. You don't like his progress. Is this wickedness on my part or wickedness on your part by threatening the health of the public for not doing the right thing? So people need to change their orientation.
So far, sorry to cut you short. So far, have there been any set of people that have imbibed this culture of environmental sanitation when you've implemented this, or everybody is proving stubborn?
It is not everybody. There are communities that we have set up so many activities, like monthly sanitation. We even make it mandatory for them to do it, right? And there are people that are monitor the exercise every month. And that's between the hour of 8 to 10, nobody opens their shop. And like I bet you can go to Kalamajiji within the area, municipal area council along Lugbe Road. Every last Saturday of the month, you go there and do your finding. Everybody lock their shop and come out to do this sanitation because it has become part of them. And then we use the influence of the local chief. Because if you cannot obey your chief, automatically you cannot obey anybody. And the chief has the power or authority to punish you within the community. That is what we do.
So you've mentioned one of the persons or stakeholders that's very important to this, which is that the local chiefs, particularly because it's an issue that mostly affects developing nations. But taking it back to a global scale, who are the other stakeholders? We've identified the people themselves. I think we've identified local or traditional rulers. You know, what's the government's role in this? Bodies like the WHO, the UN. You know, what are the expectations for environmental sanitation to happen with assistance or help or under the responsibility of these people? If to use Nigeria as an instance, we have the Ministry of Water Resources, we have the Ministry of
Environment,
we have the Ministry of Health. So, how do these come together to achieve what we are all preaching for here?
Currently, there is a one-man health policy, right, that brings about all other health bodies into one umbrella, where a medical doctor will be there, environmental health, pharmacist council, radiographer, laboratory science, and health records. All of them have under one umbrella to make sure that the health of the public is well protected. Now, coming to the responsibility or the rules of government. Government plays so many critical roles in bringing the sanitation to our doorsteps. One of it is policy. Government enacts or brings policies that will bring about changes in the mindset, changes in our thinking, changing in the environmental setting. And we have one national policy on sanitation in 2005, 2007, as was reviewed in 2017, right? Which is there to guide us on the way forward. Then government brings law. There is a National Environmental Health Practice Regulation as amended in 2016 that guide the practice of environmental health. And then, if you look at it, if you look at the body of the law, the sole responsibility of cleanliness and sanitation lies in the hands of the area councils. And in all the area councils, we have the head of department, right?
Is there any of this that we can, will I say, successfully copy or imbibe from the developed nations, pardon me, because for the most part, they've solved a lot of these issues?
Yes, everything I'm telling you is a kind of developed from what other countries have done, like US, UK, and World Health Organization. That is why every year you hear, like June 28th this year was National Environmental Sanitation Day, which we all celebrated, right? We visited a community in Piwe, then ended up at Shika community along Lugbe Road, where we gather communities to sensitize them and enlighten them under the supervision of the Minister of State for Environment, Ishaku Shola. So you can see that government has a role to play, and they are not doing it on their own. They are looking at the policies of other governments that have worked, other developed nations like US, UK, Canada, that has worked for them. So they are bringing it back, then marry it with our own culture and our own activities and level of understanding. You see that those things are gradually coming to play.
Fair enough. To talk about the issue of solutions now, and recently, we've had climate issues. In fact, later on in the program, we'll talk about how some verified voices are saying that environmental sanitation is even more of a problem, and either it's a chicken and egg situation. Some persons will say it causes climate change. Others will tell you that where there's climate change, environmental sanitation is also an issue. So what's the connection there? And speaking of to solutions, how do we begin to do these things? Like taking a look at our news items, we talked about how Oman is trying to revamp its environmental sanitation. We even saw other countries actually trying to make profits from environmental sanitation. So if you can let us know a little bit about that, maybe people can understand that other than the health aspect, there's also maybe they are more
The
encouraged
economic
by
aspect of it.
the economic aspect of it. Yeah.
Now, if you look at sanitation, it's a very broad topic to be discussed. And if you go through critically, 78% of what is affecting us today, either health-wise, arises from poor sanitations. Now, you go into the bush, right, to defecate. The moment you come out, you come to the bush, you see that in your environment there are no flies at that point in time. But when the tip of the feces comes out, you begin to hear flies coming around. Because of what? They have high sense of what? Smelling. And when they perch on these feces, they carry the germs on their body, on their skin, on their mouth, then looking for where to drop. They can come into your kitchen and perch on the table, then your food mistakenly fall on the table, you pick it and you continue to eat it. Food can be hygienically prepared from the farm to the table, to the dining table, but at the point of eating it, you may eat it with contaminated hands, right? So all those things are attitude, individual attitude that need to be changed. Then if you talk of other factors that poor sanitation lead to climate change, yes, when you continue to keep a waste in one place and you do not take care of it, past there tomorrow, you see that waste begin to decay and begin to hear what? To perceive smelling. And when rain fall, it washes that into the body of water. And that thing can likely block the drainage systems, leading to internal flooding. This is not even as a result of opening of dam or anything. That is to tell you that poor sanitation can also lead to what? Flooding, even within your own household. So if you look at it, poor sanitation also contributes to the increase in expenditures economically. If you clean your environment properly, the money you need to spend on treatment of typhoid fever, malaria fever, cholera, dysentery, and any other diseases that may arise as a result of poor sanitation can be channeled into payment of your children's school fees. As a result of that, it improves your what? Your economic growth. So a lot needs to be done for us to live a healthy life. I used to say that if you want to live a healthy environment, sanitation is the key. If you maintain sanitation, proper sanitation of your premises, you will live healthy. Because when you see, okay, for instance now, you want to live a green environment, you plant different trees. A tree you plant today may not yield a fruitful result today. But as a result of you continue to water the fruit, it will continue to grow. And it will come to a point you plug a fruit from that tree. Plugging a fruit from that tree is not only the answer, but the tree you planted take away carbon dioxide from you, which is one of the contributing factors to climate change, right? So when you do all those things, you relieve yourself from all other things that you need to do and do the proper thing. You see that sanitation will continue to be at the forefront. And once everybody put it on the mouth of everybody in the society, we will achieve greatly. So sanitation is the key for us to live a healthy life.
I think that's a wonderful note to end it on. Thank you so much, Mr. Tijani, for your experience, your expertise so far. Hopefully, the agenda, we're all partners in progress now. We're all pushing the environmental sanitation agenda. Hopefully, it yields results. Thanks so much once again for coming.
Thank you for having me.
Thank you.
See you next time.
Continue the good work.
Thank you.
Thank you. So that's how we round up this segment of the program. We've been talking with Mr. Tijani. He is an environmental health officer. Has also been with the Environmental Health Council of Nigeria. We'll end this part of the segment now, and we'll go for our verified voices to hear what these voices are saying on the issue of environmental sanitation. Stay with us. We'll be right back. Welcome back. This is still Hude Hour on the Hude Network, and we're still discussing the issue of environmental sanitation. On this segment, this is verified voices. We'll be taking a look at what the voices are saying as regards environmental sanitation. Without further ado, let's take a look at our first one of the day, and that's from the United Nations. From the United Nations, there we have that Democratic Republic of the Congo, escalating violence is severely depriving millions of children of their fundamental rights, from access to clean water and sanitation to education. UNICEF is stepping up efforts to protect their well-being and future. It's a very simple one there. This is the intersection. We've discussed a lot of intersections today
Yeah.
and the different SDGs. This one in particular is about, the children, access to education, water, sanitation, are things that are being deprived of because of, escalating violence, as we've seen on from what the UN is saying. So that's an aspect of, ensuring peace or failure to ensure peace, also leading to lack of water, education, and so on. And like we've carefully dissected on the program here, sanitation is very important, and these kids are being deprived of so much.
Well, we hope for a very, very good one. Let's move to the next verified voices that we have. This is from United Nations and it says clean water is a right, not a privilege. Yet billions of people lack access to safe drinking water and sanitation. And the climate emergency is making things worse. Okay, the pictorial representation you have there, you're seeing clean water uh, is human rights, privilege cancelled. And the global goals aim to address the water crisis and ensure access for all. I think what's really, really caught my attention there is clean water is a right, not a privilege. You're not privileged to have clean water. It's your right to have clean water. And yet, billions of people lack access to safe drinking water and sanitation. It's not really a good one at all. Yeah.
Indeed, the UN has put it out there again, and I think it's, we need to look at it the right way. Like we said during the conversation, we really broke down the importance of water because I think a lot of people, actually, when we think about it, have become so privileged that they think that water is something that can be found just anywhere and everyone. But then we are beginning to see that a lot of people are being impoverished due to this. I will take a look at our next verified voice there. We have from UN Water. They say toilets are a place for peace. 3.5 billion people live without a safe toilet all over the world. Sanitation is under threat from conflicts, climate change, disasters, and neglect. This is just the UN Water further stressing how important toilets are, because I think, again, when it comes to environmental sanitation or sanitation in general, we have to understand that these things matter, and it's not just about the broad concepts. If you do not defecate in the open, it means it's being done safely with these toilets. So that's why they matter. That's the UN Water speaking, because you would expect UN Water should, stick to rivers and oceans, but
Yeah.
it shows you it's a broader topic than most people understand,
Yeah.
and it's a good one to hear from the verified voice.
Okay, now we have the last verified voice. This is coming from the World Bank Water. Amadine took the UN Water, and now I'm taking the World Bank Water. So it's asking a question. Did you know developing countries invest $164.6 billion yearly in water? That's $164.6 billion yearly in water, but only 1.2% of budget go into it, compared to 4% for transport and energy. For more, you can see the link. You can get more stories from that. This is a very, very huge question to ask the world. Did you know developing countries invest $164.6 billion yearly in water, but only 1.2% of budget go into it?
Yeah,
That's not fair at all.
indeed. Compared to what we get for transport and energy,
Yeah.
it's all still quite little. But again, I think it shows that water needs to be taken much more seriously in the environmental sanitation agenda. So that's how we round off the program for today. Don't forget to join us once again on Hude Hour on the Hude Network where we bring to you developments within the humanitarian and development space, and we break down each of these issues to offer more solutions, advocate for better ways to do things, and ensure that we all have a better life at the end of the day. Thanks so much for joining us today. I am Amadine Ogbewe.
And I am Joan Eze. Thank you, and bye for now.